Alex, thank you so much for joining me here today.
Great honor, thank you.
I wanted to talk about one of your interests, which is engagement.
Yeah.
I hear that a lot as kind of a buzzword, but what does it mean to you? How do you engage with your work?
So I'm obsessed with this concept, and mostly after having spent about 20 years in this space in the healthcare industry, mostly I think about how terribly we do it. And I think we do engagement poorly because for the most part, we're just not selling something most people want to buy. We're not solving problems that most people want solved. And if you want to engage people, you need to start with what matters to them, what's waking them up at night, what would speak to their soul, and go there, and then engagement will naturally follow.
So we're not actually focusing on the correct burden of disease?
Yeah, I would argue very strongly that if we want to bend trend, if we want to meet people where they are, if we actually want to make an impact on people's health and productivity, we need to expand our definition of health, include these life challenges, and recognize that somebody who's going through a divorce is incredibly debilitated. I've had a divorce. I wanted to go through it, and it was still one of the most terrible experiences of my entire life. And I think every day about the number of people that we're reaching out to lecture about their diabetes, to talk to them about their blood pressure. Meanwhile, they're laying on the ground sobbing constantly because they're going through a divorce. So I think we need to do a much better job asking people about the things that really matter to them, help them solve those problems. And technology today would let you do that. There's a lot I could do for you if you're a caregiver. There's a lot I could do for you if you're going through a divorce. And then maybe through that process, I free up some of your capacity so we can then actually talk about your high cholesterol, your high blood pressure, your asthma, your diabetes, whatever else it might be.
How can technology help reach people where they are?
So I think about this a lot. I think in the healthcare space, one of our other challenges is we have so many bright people who really understand technology, and I feel as though they fall in love with the technology first, and then it's technology in search of a problem, like, ooh, I'll build this big mobile thing, and they're like, what should we do about it? I think people who start companies that actually solve the world's problems and find enormous success in getting people to be engaged start with, what am I lit from within to change? What problem must I change about the universe? For me, it's how do I help someone who's going through a life stress? How do I help someone who's a caregiver? How do I help someone who doesn't like their job? How do I help someone who's, dealing with end of life? I think once you've defined the specific thing you want to do for someone, then you go out and find the technology that can help you support it. I think we flip that too often. The other thing we've seen in a lot of the literature is these life challenges actually do drive health. They do drive cost. So there's, in a world where it matters that you're making an economic argument to the folks who are going to invest, there is a clear ROI to helping someone better manage being a caregiver. And there are clear resources that exist that you can hand walk someone over to help with that.
Really exciting. Thank you so much for speaking with me today.
My pleasure. Thank you.